Hi, this is Tom Moting at the University of Iowa. I'm going to show you how we use Kitaro Eyes in the operating room to help with our training program. The Kitaro Eyes come with an artificial eye that has an artificial cornea, a membrane for capsular rhexis with this head, and what we do is we secure it on a Mayo stand with a pouch here to collect fluid. And this allows us to use these devices in the regular operating room because there's no animal products, no cadaver products. We use the regular instruments that we use for surgery. We're using the same chair that we use in surgery. We use the same foot pedals, and this allows for a very high fidelity simulation of cataract surgery. We typically have already done some training before the resident uses these eyes. They've already done incision work in the wet lab on pig eyes and cadaver eyes. They've already done a lot of rhexis training using the IC simulator or on pig eyes. But you can see that the membrane here that is for simulation of the rhexis is pretty good. It's a little bit stiffer than the natural rhexis. There's some difficulty because the hard plastic cornea makes the utrata forceps sort of more difficult to use. But they can be done. You can also do the rhexis using a needle. Sometimes the rhexis will tear funny. You can see here there's sort of an awkward tear. But in general, the rhexis simulation is reasonable. Probably not as good as the IC, probably not as good as a pig eye. You can do things like rotate the nucleus within the capsular bag. Here you can see the resident is having some trouble getting it to rotate. There's even an artificial cortex here that you can see beginning to fluff up a little bit. But here through the paracentesis, the staff is showing that you can rotate the lens by having a single point of contact and staying in the same diameter as you go around. One of the really nice things about the Kitaro Eyes, and one of the things that's hardest to do with the other simulation modalities like the IC and like pig eyes, is to do nucleofractus. There are several densities of nucleus that you can purchase with each of these Kitaro Eyes. And what's really nice is you can do a nice groove. You can spin these lenses with the same instruments that we use in the operating room. The feel of the spinning and the feel of the anterior chamber is very similar to that of a human eye, which is not necessarily true with pig eyes, which are much bigger. And you can see that we're able to crack the lens. You can chop the lens. You can spin the lens and break it into 4 pieces. The plastic material, or whatever the material is that the Kitaro Eyes use to simulate the nucleus, is a little bit harder in some ways, and there's a lot of chatter. Not a big deal, though, because it's not an important thing to simulate. Well, this is Tom at the University of Iowa. We just wanted to show you how we use Kitaro Eyes for our training program. Thank you very much.